Hello, my name is Natasha Worth for Hays State University, and I am discussing Chapter 5, Prescribing. The objectives for this chapter is identifying what prescribing authority for nurse practitioners have, define the controlled substances, list classifications of controlled substance, describe each schedule of the controlled substance and also list examples for them, and then identifying the prescribing authority for each state. Nurse practitioner prescribing authority is that they do have it in all 50 states and the District of Columbia. However, the independence does vary by state. Depending what state you live in depends on what prescribing authority that you do have, and they also use other words than prescribing. The states have specific guidelines that you have to follow as a nurse practitioner to prescribe. Some of them have no physician involvement necessary for 17 of the states and the District of Columbia. Utah has physician involvement only for the Schedule 2 and 3 classifications. There are 33 states where explicit legal authority to prescribe with a collaborative relationship with a specific physician, and all of that has to be documented through the DEA. And there's also Michigan's law permits physicians to delegate medical functions to the nurse practitioners who do not have specific legal authority to prescribe, so theirs would be very specific to what the physician delegates to them. And then there's 48 states and the District of Columbia that allows prescribing of controlled substances. This is a list of the prescriptive authority. So no physician involvement required is that list on the very left side. As you see, there's several states that actually have that. The middle section is physicians may delegate authority to prescribe, so it depends on which physician that they work for. And then the physician collaborative requirement, which includes Kansas, is on the right-hand side. Controlled substances is narcotics, depressants, stimulants, and hallucinogenic drugs covered under the Controlled Substance Act or a federal law. And nurse practitioners prescribing is 49 states and the District of Columbia that actually can prescribe controlled substances. And there's 5 schedules for these controlled substances that I will discuss on the next slide. The controlled substance starts at Schedule 1 and goes to Schedule 5. Schedule 1 is the first one, which there is, it's not accepted for the medical use in the United States. It has high abuse potential, and these are drugs such as heroin, the LSD, ecstasy, marijuana, and the peyote. Schedule 2 is the high abuse potential with severe psychic and physical dependence liability. They have therapeutic utility of it, and the examples would be our pain medication that we use on our patients, such as morphine, codeine, fentanyl, hydromorphone or Dilaudid, the meperidine, methadone, pantopon, and opium. It also includes stimulants, which would be your amphetamines, and the depressants such as the pentobarbital. The Schedule 3 is your stimulants and depressants with the abuse potential but less than Schedule 1 and 2. These would include your mixtures of your medications like your Tylenol with codeine, and the mixtures of the amobarbital, the pentobarbital, the secobarbital, and other non-controlled medicinal ingredients. Your Schedule 4 is less abuse potential than the Schedule 3s. These are your depressants such as your alprazolam, the phenobarbital, and the chlorohydrate. And then finally, the Schedule 5 is less abuse than the Schedule 4. It includes preparation during containing limited quantities of certain narcotic and stimulant drugs. These would be your antitussives, antidiarrheals, and the analgesic purposes. And the examples for these are the buprenorphine and the propylhexedrine. States that actually allow nurse practitioners to prescribe your schedules 3, 4, and 5, and then the controlled substance, but not schedules 1 and 2 are listed here, has your Arkansas, Louisiana, Oklahoma, Texas, Georgia, Missouri, South Carolina, and West Virginia. There is this map also that is very handy. It's the descriptive authority for the nurse practitioners. And clicking on this map, it actually is very detailed. And then here is the states that allow nurse practitioners prescriptive authority for drugs falling into the schedules 2, 3, 4, and 5. So these are all the states that can prescribe these narcotics within this schedule. The Drug Enforcement Administration, which also known as the DEA, it oversees the nurse practitioner's prescribing of the controlled substances. So nurse practitioners have to register with the DEA, and once they register with the DEA, then they obtain their own DEA number. The DEA number for the prescription or for the nurse practitioner then has to go on the prescriptions. The whole point behind DEA is they track the healthcare providers for prescribing practices. It's a method to minimize the unauthorized prescribing, so those that might actually try to apply and register through the DEA and get a DEA number, they would monitor that and they look to see if you have a good standing license and if there's any thing on your record. Based on the applicant's compliance with the state and local laws, they may require separate controlled substance license, and the state that does not authorize nurse practitioners to prescribe, then they would not get a DEA number. So that's a way to kind of track it and make sure that it's a safety feature. It is $731 for a 3-year term for your DEA registration, and you would have to renew that every 3 years. You get a notification prior to your term being up so that you can renew it just like we do with our nursing license. The DEA issues registration to the nurse practitioner's name only at the business address. They would never send it to your own personal address. They have to send it to the business where you will be working, to the physician that you're going to be working under, if that's part of the regulations in your state. The nurse practitioner guidelines for prescribing legally. You have to make sure, obviously, you have the right medication at the right time for right indications for the right patient, the 5 rights that we're used to as nurses. Follow the practice protocol or guidelines in the facility, whatever they say you have to follow within your state and the facility that you're working with. Adhere to standard of care in prescribing if no facility has a protocol. Questions that you always want to ask before writing a prescription to your patient would be, are you pregnant? Are you breastfeeding? Do you have any allergies to medications? Have you ever taken this specific medication that you'd be writing the prescription for? And if so, did it work? And did you have any ill effects from it? Do you have any liver or kidney problems? What other medications are you on? And what other medical problems do you have? You'd also want to identify any cross-sensitivities or allergies to medications. Address any contraindications that they might have had with some medications that they've taken, or any drug interactions that they might have experienced in their lifetime. You also need to inform the patient of any potential side effects for the medication that you're going to prescribe to them, and then instruct the patient to call if there are any adverse changes. Now I'll talk a little bit about Kansas and the 4 surrounding states. In your book, it talks about every state, very specific for what their protocols are, and what you have the ability to do for your state. So I would look up whatever state that you're in so that you're familiar with it. Kansas here, we are able to prescribe per written protocol, so we have to follow the protocol that is developed by the physician that we're working under, and then we need to follow that protocol very specifically on what assessments the patient has, what assessment findings, what are the symptoms, and you'd follow the algorithm for you to be able to know what prescriptions that you can actually write. Has to be authorized by the physician. You have to have their name and their address sent to the board, and so that they have that on file on who you're working under. And then there's specific criteria on the protocols, the place of practice, annual review with the physician, and detailed prescription writing. So our listing in the book was probably 2 or 3 pages long, and it was very specific on what we had to do and very specific to each one of these groups, the protocols, the place of practice. You have to sit down and review those protocols with the physician every year, and then the detailed prescribing. In Nebraska, the nurse practitioner definition would be health promotion, health supervision, illness prevention, and diagnose, treat, and manage of common health problems and acute and chronic conditions. They have the prescribing therapeutic measures and medications related to those health conditions within their scope of practice, but they work within the physician collaboration agreement, so that's how they get their authority to prescribe. In Colorado, they do verify that you have a good standing license without disciplinary sanctions. If you fulfill all of those requirements, then you have the authority to prescribe controlled substances. It was interesting to read through each one of the states in the book because some of the states were very, very detailed, and other of them were very short and to the point, very brief, almost a little scary, where we could fall into error not being as detailed as some of the other states were. Oklahoma, the prescribing schedule 3 to 5 controlled substances allowed for nurse practitioners, and then they can prescribe no more than 30-day supply for those 3 to 5 controlled substances. In Missouri, there's a collaborative practice arrangement for administration, dispense, and prescription drugs. They may prescribe controlled substances for 3, 4, and 5. And then what I found very interesting in the Missouri pages that I read was that it was very detailed on who the nurse practitioner cannot prescribe controlled substances to the point that it said no parents, grandparents, great-grandparents, aunts, uncles, cousins. It even went to mother-in-law, father-in-law, and your children, obviously. So it was very detailed on who you could or could not prescribe the medications to, which you didn't find in all of the other states. The Kansas prescription details that I found on the KSBN website was very specific. There were 5 of them listed, so we have to include the name, the address, and the telephone number of the practice location of the advanced practice registered nurse. We have to include the name, address, and telephone of the responsible physician, which you have to write that on the prescription as well when you're writing a prescription and practicing in the state of Kansas. Be signed by the advanced practice registered nurse with the letters APRN behind it. Be from a class of drugs prescribed pursuant to the protocol, so therefore we have to go back to the protocols that we have to follow in the state of Kansas on what we're allowed to follow with the algorithm of what the patient's presenting with and what we can or cannot prescribe for those symptoms and diagnosis. And then contain the DEA registration number issued to the advanced practice registered nurse when a controlled substance, as defined by the KSNA 654101, and the amendments thereto is prescribed. So the Kansas State Board of Nursing also has some specific things for the nurse practitioners as the other states for prescribing authority. This chapter was very interesting to me, as I know that state to state it does vary, and how jumping from one state or practicing in one state and then practicing another could be very confusing. And I think it's very important that we follow these and really know our state, the one that we plan to practice in, and realize that it's different in other facilities. And obviously monitoring the prescribing of the controlled substance is so important because of the patients that are seeking and the opioid crisis that we're dealing with these days. So this was an interesting topic for me, and I really enjoyed it. These are my references. I used the American Medical Association, which was that state law chart, our textbook, the Kansas State Board of Nursing for the Nurse Practice Act that list very specific details for us practicing in Kansas, and then the nursing license map with the websites there. Thank you, and let me know if you have any questions.